We will begin with the first session of day 3 titled Case Studies of AI in Healthcare. This session will explore the transformative role of AI in healthcare sector, showcasing practical applications that have improved diagnostics, treatments, and patient outcomes.
We are honored to have with us Professor M.P.S. Bhatia, professor at Netaji Subhash University of Technology, Delhi, as the speaker for this session. With over 25 years of academic and professional experience, Professor Bhatia is a leading authority in applying AI to solve complex healthcare challenges.
Thank you, Professor Bhatia, for joining us today. We look forward to gaining valuable insights from your expertise. Over to you, sir.
Hello, I'm audible?
Yes,
Okay.
sir.
Yes, sir.
Good evening, everybody. On behalf of my university, I thank Professor Achal for inviting me for this FDP. And I have a very long relation with BPIT and especially the computer science department. So I'm really honored to be part of this FDP and let me see if I will be able to tell you about what are the contribution of AI with respect to the healthcare industry, healthcare, and how basically what are the various companies, how they are doing, and all these things. So to start with this, again, I thank you, Professor Achal, for inviting me for this part, and I will be able to take certain lectures, certain questions also if you have, or maybe in the later part of the day. So thank you. So to start with, I will start AI as there were different lectures which already has happened here with respect to AI, and there are a lot of industry people who have already discussed about the AI part. So my specific thing will be I will just cover about AI and will try to share some of my personal experience which I have with the industry and other part. So to start with, I will just and at end of the talk, I will try and cover what we call it as a generative AI, which has been already covered. Introduction has already been given in some of the lecture. So I will try and see if I can cover some of the part of generative AI application into healthcare, how it is transforming whole of the landscape. Uh, so AI, healthcare is a very important component here in healthcare. AI is very important component, and healthcare is one of the important. So there are several companies to start with. What are the companies which work into AI? There are several startups which work into it, and there are several big companies like Google, Microsoft, IBM, Apple. All of them work into this area and try to contribute their bit towards AI into healthcare. So I will try and cover one of the real case study which I have with me of my student who is suffering from kidney transplant, kidney disease, and she probably needs a kidney transplant. She is in US, and I will try to see what are the challenges she is facing, and then how basically we are trying to cover how AI is helping her in recovering from that kidney disease and how she's surviving, and later on what are the devices which are going to come in the later part, how people are doing research in this. So this is 1.5 hours is very less time, but let me see whatever I can cover into it, and will show basically about the AI in healthcare. So there are, let me just go and talk basic about the AI thing. Let me see if I can uh, uh, cover some of the things. And so let me see if I have those stories with me. And Dr. Achal, it is visible or?
Not yet, sir.
Okay, okay. Let me see. Let me try out some other way out. Hello.
Yes, sir. Yes, sir.
Uh, Let me see. There are some issues. Let me come on to that later and see if I can open it out here. And there is some issue here in opening my slide. Let me see digital. Let me come on to. Okay, I can minimize it and maybe I can. Uh, can you help me out, Professor Achal?
Yes, sir. I mean, if you can share, I can share with
Uh,
me. I can share it from here.
Acha, let me see if I have. Let me entire screen. If I go to entire screen, it should be able to get me, Hannah.
Yes.
Let me. Okay. Uh, Let us wait for another 5 minutes and let me cancel. So to go ahead with this, let me cover some of the advantages which AI is going to have in this healthcare. I will, as I was discussing with one of my, as I was discussing about one of my student who is suffering from kidney disease and all that, I will cover those things. So the main use cases for AI health case is medical research and development is one of the main case for AI healthcare. So in this medical research and medical research and development, uh, you most of the doctors have huge amount of literature which they have to review, and probably after taking this review of this, they need to uh, they need to look at those lectures, and probably after looking at those literature whatever is there, they need to probably see to it that that gets implemented or comprehend something. Like what we do in research is we try to find out literature review, and from that literature review we try to outcome. So same is the case with the doctors. So they have a lot of medical the medical manuals are there for each and every operations which they do. they have some sort of a SOPs laid down for it, and they try to follow all those. So different profession, it may be pediatric, or it may be a doctor who may be having specialization in medicine and all that. So they have a huge amount of literature with them. So same way which we do something called as a SLR, we have something called as a systematic literature review. So they also have those literature, and uh, and they have performed certain operations, and these case studies are available throughout the world. So these case studies, one of the case studies may be available in say Medhanta Hospital, another may be available in say AIMS, or another may be available in say Gangaram Hospital in Delhi. So if there are different case studies available, is there any, can AI comprehend these? Can AI comprehend this together and see to it that whatever are the important points or the things which are required by the doctors or those people who are doing are the students, can learn about it and can implement. So the first and the foremost thing, which from my point of view is medical research and development. So there may be some discovery, or there may be some important things which might have happened in say somewhere in US. And is there any in say Stanford, or maybe in Harvard, or maybe in down in Australia? So all those things, is it possible, can AI generate out some summarization? And maybe generative AI, can it generate out automatic literature review for all those case studies, and comprehend and give to the doctors who are interested in using? So this here, the AI and the generative AI plays a very important role in in generating out all these information which can help the doctors and all that. The other thing is drug discovery. uh, Drug discovery is a very important drug discovery is a very important point, which important thing related to drug discovery and development is a very important thing which is related to medical sciences and healthcare. So every time, each and every the country and the researchers are trying and their level best to find out different combinations of drugs which will be helping out, not the patient, which will help out patient and the country at whole. So every time the research is going on, but the amount of time which it takes in discovering any of the drug, it takes huge time. Is it possible with the help of AI, can this time be reduced? Can this time be virtually reduced, so that once we are able to reduce this time with the help of a lot of libraries are existing, a lot of tools which are existing with the help of AI, these are existing. Can we do that? Yes, it is possible. So one can use generative AI, which allows efficient analysis of those data sets. And these data sets can help us in what we call it as a clinical trials. So these clinical trials, whatever are required to be done by doctors or by the researcher in medical field, it helps them in it helps them in identifying those things, and uh, probably probably most of these researcher whosoever are interested in doing drug discovery. So this was able we were able to see most of these things during this, what we call it as a pandemic time, when a lot of COVID during the pandemic time, a lot of vaccination was discovered in no time. So the other thing which is patient matching. There is a need for accurately associating and evaluating the patient data and health record, and which may be appropriate for healthcare services provided for improved patient care. So the important other important thing in the healthcare domain, which is in the huge demand, and the people are the lot of hospitals, all the stakeholders like hospital, the regulators, and the government agencies are working together to see to it that how best the patient care can be done. So are there any tools, algorithm, which can really generate out those generate out those tools, or maybe apps which can help the patient care. So like in the COVID time, we might have seen that most of the times it was very difficult to get space in the hospital. Nowadays also, most of the hospital try, because there is a scarcity of beds in the hospital. So making ICU available at the homes is possible with the help of AI and generative AI, because real time the data is being captured from the ICU which was there in the hospital. Now the real time data is being captured from the home. With the availability of the technology, with the availability of bandwidth, now this is possible that whole of the data which was required to be analyzed by the doctors sitting in the hospital, now it is possible with the help of the patient may be sitting at the home and will be able to. So there are a lot of devices in this area, the patient care. A lot of devices, the electronics has gone into it, the computer science has gone into it. A lot of devices are being made. So these devices are most of these devices are IoT based devices, and which generates a lot of data. This data is being captured centrally at the hospital, and the hospital doctor um, uh, can take call onto it and can analyze and immediately immediately take action whatever is required. So I know a couple of people who have a problem for pulse rate in the heart and all that. Now it is very difficult to go there. So people have those iWatches, people have those devices which they put near the heart, and the data is being captured out. And this data, once captured out, is being either stored there, or through IoT devices, it is pushed into the hospital or the doctor who is monitoring that data. And immediately some need is required, they can do and help it. The other area in the patient care is, like we in India, the whole of the country is divided into different parts, where there may be certain area which is not approachable by doctors. But yes, if we need help and all that, so there again we can have those devices out there, devices which are IoT based devices, and immediately some action, it may be a hilly area or it may be any area which is not easily approachable, can be easily done with this. Then other than that, so there is a lot of research which is going on in this. So this research, yeah, there is a lot of research which is going in it, which this research may be related to uh, IoT devices, wearable devices, and data capture. So these are the this helps in not only the insurance company, it helps somewhere insurance company, it helps the patient, it helps the personalized thing. The other is the patient education is another area which is very prominent area or a use case for this. So what this prominent area for this is in this basically there exists limited means to create and share easily digestible health information with the patient, which would assist them in responsible decision making. Like let us assume there is SOP which is late for say for COVID, or maybe for tuberculosis, or it may be have been late for this. Can this generative AI help? Can this generative AI can help the patient to get educated about particular disease. So this disease may be anything. Let us assume there may be a person who may be suffering from tuberculosis. There may be patient who may be a cancer patient, or there may be patient who may be having something else. So all these things one can easily go ahead and learn about those things on its own with the help of generative AI tools, which will help which will be in most of the time, it will be in the interactive manner. And this interactive manner, they can learn about those diseases, medical condition. Now, there is a challenge. Is it possible to have all these tool for patient education in multilingual and all that? So in India, again, there is a lot of research. There is a project which has been given by Government of India also, which to produce multilingual chatbot, and so that the patient can really understand the research and understand about various trends in the healthcare and try to take decision with the help of the doctors. Other is patient virtual assistant. This is another important thing related to the healthcare, where AI is playing a very important role. There is Because every time we visit hospital, every time we visit doctor or see the doctor, there is only the limited time the doctor has. So is it possible? Is it possible to have something virtually to find out certain virtual things? And so if we are able to find out those things with the help of chatbot, then this will help us. So this generally is with the help of querying on the chatbot. So if we uh, put certain questions, there are some predefined answers which are there. So if we are able to do those things, then this will help us. Not only This will not only help the hospitals, the healthcare provider, the companies, and the patient involved. So not only the patient assistant, but this patient assistant, if he can ask chatbot, is my insurance valid for this hospital or not? What is my billing option? What is my payment options? What are my benefits related when I get admitted to this? So all these things can be available with the help of patient virtual assistant, which one can get, which one will be able to get easily with the help of this. Then there is something called there is something which which is called as enhanced care coordination. So in current healthcare landscape, care coordination remains uh, important point. Why? Because it is mostly insufficient, because enhancing care coordination and recommending action on human-like interaction is becoming a very challenge. So there are there might be certain patient which may be diabetic patient, there may be certain patient which may be allergic to certain medicine and all that. So generative AI and the AI generally they generally help in they help and find out how basically we can do a tailor-made help for the patient care. So uh, uh, generative AI, or maybe AI, the AI can take this and help those making patient decision making. By making decision, he will be well informed whether what action he has to take and all that. So this enhanced care coordination is very important, except for is an important use case. So these are all use case for the healthcare. So till now, let me recap and then we'll come on to the further more. Till now, what we have learned about is that one of the important use case in the healthcare is something called as a medical research. Another is drug discovery use case. Another we have learned about is, or we have discussed about, is patient matching. Another is patient education. Another is patient virtual assistant or enhanced care coordination. Uh, the the next use case is medical images diagnosis. So most of the time when we go to the hospital and all that with certain ailment and all that, the first thing and the foremost thing is the diagnosis. And among the diagnosis, most of the doctors prescribe, depending upon the patient condition and all that, they describe certain scans to happen. So these scans may be either CT scan, or it may be MRI scan, or it may be simple X-ray like thing and all that. And other than that, there may be certain things which may be related to some pathology test which has to be performed. Now, the important use case for healthcare point of view and from this is, can these doctors or the hospital, whatever medical diagnosis are being done, the images are being captured, uh, is there any way to find out those patterns out of it? So there is a lot of research which has happened in this, from computer vision point of view, to find out those patterns. Let us assume a doctor is interested in finding out some brain tumor into it. So once he looks at those MRI or CT scan images, he will his radiologist and he himself will try to find out where the tumor is, what is the size of the tumor, whether it need to be operated or not. But if we, so there are a lot of tools which are available. The machines have been trained out with the different data sets. So once we are able to train out these uh, machine with a lot of data sets, and in uh, in healthcare in India, again, a huge database, because there are a lot of MRI and CT scans happens. So there is a huge bank of MRI and CT scan. So the doctors are trying to train with the help of deep learning and all that, and then try to find out certain patterns. So that makes this helps the doctors to find out those tumors of what size they are, and then probably take action onto it. So imaging and enhancement of images, finding out of the parameter with the help of AI or generative AI is another use case, and which the whole of the researchers from computer science point of view and medical fraternity are doing research into it and trying to find out what patterns a doctor needs, and AI or the computer science person try to figure out and see to it how the images can be enhanced so that the results can be given very fast, and which can help doctors in visualizing properly and potentially reduce the need for additional time for diagnosing those diseases. So this is very important thing which is from medical fraternity and from healthcare point of view. Uh, Imaging is very important. So till date, there are a lot of models which have been trained out, and there is a lot of research which is happening out in India as well as in other part of the country, which they are getting those data sets, and then the doctors and the engineers are trying to train those data set, and once training happens, and then they try to find out whatever images, they scan it out, they feed to it, and then they try to find out those patterns out of it. Other than that is a use case for this is disease diagnosis. There are a lot of like I have to go to a doctor for getting the healthcare. I need to go to a doctor and to diagnose certain diseases and all that. So if there are from AI point of view and generative AI point of view, there are a lot of tools which are available now, which help doctors to diagnose those diseases in the lesser time. So these tools, depending upon the medical history and all that, once it is fed, the medical history is fed to the the chatbots, which will help that chatbot, which is enabled by human being, to understand those medical history and try to predict the disease diagnosis with the help of the doctors. So there are a lot of ethical issues also involved. So we need to look into these regulator ethical issues and all that. But the medical after giving the medical history and the symptoms out in the chatbot, it may expedite the process of diagnosis of the diseases. So this diseases diagnosis is again a use case where uh, the doctor uses healthcare and try to diagnose for this. Then there is something called as a personalized medicine. The time is going to come, like Indian government always encourages uh, doctor to prescribe generic medicine to the patient. There are certain specialized medicine and all that. So because each and everybody should be able to afford those medicine. But the other side, a use case for medical diagnosis is or the personalized medicine is that if I have a history of or genes and all that, is it possible to subscribe certain medicine using health using AI chatbot? So is it possible if we use AI chatbot, can it recommend personalized medicine for the doctor? What time a particular medicine need to be taken and what not to be taken? It just and with the help of doctors. So still there is a lot of research which is going on in this area. It is still open where because there are regulator, we need to follow all the ethics and followed in the medical before doing that. But the generic type of medicines also, there are a lot of companies which you might have seen uh, like Tata 1mg and other they try and generate out doctor meeting, and then after getting a meeting they try to prescribe you the medicine and you can easily go. Then is a predictive, one of the important use case for important use case for this is what we call it as a predictive analytics and risk assessment. So what this basically predictive analytics and risk assessment is that uh, is there any mechanism to basically forecast the complications and the post-operation treatment plans for a patient? So is it any way by which we can really find out way by forecasting the complications a patient may have, or maybe post operation what are the steps? So same way what we have is we try and we look into what we call it as we look into historical algorithms for algorithms which can identify patterns and predict future risk. So with the help of AI, one can easily have a historical data and into ML and have those algorithms in place to find out the patterns and then predict future risk. So this is possible with the help of, so this is an predictive analytics and risk management is again a very important use case. It's a very important use case for with respect to what we call it as healthcare, where one can find out historical data, and then basically once we have those historical data and all that, he he can even leverage those things out of it and find out whether a person is at risk. So same thing happens for determining and diagnosing a cancer or any disease. So you feed those data into the machine and try to find out the predictive future risk, and which will help the doctors to manage the condition and all that. Other use cases, risk management after operation. So what happens is most of the time when the operations are done by the doctors, there is a set of process which we need to follow after what we call it as after operation. So after operation, these processes which we need to follow. So this once we follow those processes, we need to look at we need to look at we need to look at and feed to the system and try to get a list of the things, so the AI can easily help out the patient to see to it and follow post operative things. Then is the important thing happens out is which I will also give a use case about my student also, is real time health monitoring. So it may be happening in hospital or post operation. So are there any tools available? Are there any tools available? Let us assume the person who got some sort of a some sort of a operation done, and he never wants to stay in a hospital. He needs a daily checkup by the doctor and all that. So AI help doctors post operative thing by what? By the patient can stay at home, and real time the parameters like BP, sugar, heartbeat can be monitored by a system which is there at a home, and these information can be directly given real time to the hospital and hospital to the doctor. So this AI has played a very important role in post-operative care in this. So you might have seen during nowadays again, uh, this is most of the hospital discourages people to stay more time in the hospital, and after operation they encourages people to go home and have those devices which may be rented out and which are connected in a real time to the. So by this uh, real time data on the real time data on medical adherence, patient vitals, and if required important intervention, then doctors can immediately take action and suggest a patient to do certain things if there is something happening out thing. So real-time data, which is captured out maybe through the IoT devices, which may be installed at this, or it may be wearable devices, which may be at home and all that. So AI plays a very important role in this. Then another stakeholder in this whole of this healthcare is the hospital. So you can well imagine what was the condition of the hospitals a decade back, and what is the condition of hospitals nowadays. So most of the hospitals nowadays are their processes, the health hospital operations are now AI based operation, where you have almost every record is on EHR, electronic health records are there, which are being maintained, and the doctors can do a follow-up for post-operative or other thing, and even this can happen that earlier, whichever was there, if any other patient comes, so this database can be further used for this. So a patient and patient care management assistance are the important thing which this hospital have already with the help of AI they have already implemented into this. The other thing is EHR, the health electronic health records have been maintained. You might be knowing the Indian government has implemented ABHA, where you can register using your Aadhaar card and whatever in one of the hospital, if you have certain CT scan or MRI or maybe some doctor prescription, so same Aadhaar card can be shown to other hospital. So this is with the help of completely AI application in healthcare, where the government of India has implemented, where seamlessly any doctor sitting in any government hospital can view a particular patient number, name, records, and can prescribe. Let us assume a patient who is working here in one place in Mumbai, he shifted out in Delhi, or maybe from Delhi to somewhere in Uttar Pradesh and other part of the country. He can carry all those records with him. There is no need for carrying those records, physical records. So all those records are digitized. Again, it is in process. This project is in process of Government of India. Again, there are a lot of things which are happening out, and day by day the advancement is happening out in this project. And other thing which is with the help of this is that the private player, whosoever are giving insurance to the patient and all that, they can also view the electronic records and can take a call whether the insurance has to be given to a patient or not. uh, the other thing which is most of the time earlier when we were doing those pathological test and all that, is it possible that I do my blood test? Is there any tool which can analyze that? Maybe 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 in 5 months, what is my condition of blood sugar, or what is my hemoglobin or vitamin D? So all those tools have been implemented by hospitals and the labs which are doing this blood test and all that. And whenever they generate out the reports, they give you the report, but they try and give you the reports which analyze what was your condition in, say, 2 months back, 3 months back, and what is the condition now, whether it is increasing or decreasing. And again, most of the doctor, when in the hospital, when a person is discharged, when a person is discharged, uh, the doctor has to prepare the doctor has to prepare a summary for it, and for next time visit. So most of the doctors are trying, and whatever at the time of discharging, whatever medicines have been described and all that, they are being captured electronically. And they are again using AI tool to do post operative or next time visit to the hospital. So these are the things which are being used by most of the healthcare industry, and try and implement. Other thing which is happening out, and another important thing is robotics operation. A doctor which may be in a healthcare industry which has a doctor may be sitting at one place down in another country. Is it possible to do a operation sitting out in one part of the US, or one part of a specialist who is sitting in Australia, or maybe in UK or in US or other place of Europe? Can he perform some operation sitting here with the help of robotics and robotics arm and the doctors who are sitting in Ames Hospital? Yes, this is possible. So this advancement in AI, the computer vision, and with the help of artificial intelligence, the doctors are being assisted by robotics to robotic arm to perform operation precisely, whatever thing they need uh, are there, and the doctors are there, and the doctors, with the help of a lot of AI tools, they can perform this operations and can really look into it. Let me also see if I can tell you about certain more things on this, on more of the use cases. So other is we have whole of the workflow automation has been done. The efficiency has increased with the help of AI. Other thing is there is something called as a reduced human error. Why? Because most of the time we are using AI, and it doubly check these algorithms, doubly check and see to it that the treatment is done. Then, is there any AI also help in what we call it as a cost reduction, which where AI can analyze patient data and identify unnecessary and redundant tests which were not required. So you can do so with this. The cost is also reduced. It also optimize the resource allocation in this. So I have talked about robotic assisted surgeries, which has been possible in India with AI robo provide surgeons with unmatched precision and control. So one can use all these AI based robo, which are AI controlled robo. So this AI controlled robo can perform unmatched precision and control what we call it as a surgical procedures, which will help out in this. Then, with the help of MRI, and another use case is that MRI, CT scan, all that can those doctors immediately use these image guided surgeries. So now with the help of AI algorithm, all those MRI, CT scans can be easily available with which are available with the surgeon, but they with enhanced visualization they can perform those operation. This another thing which is happening out in the healthcare industry is about what we call it as another important use case is the use of what we call it as a virtual reality and augmented reality in the surgery. Why? Basically we need to train the doctors to perform operation. So is the AI is creating those models which is helping doctors to perform surgery in a real time environment. So environment is created, which is a real time environment is created. The doctor who is a trainee doctor tries to perform a operation and tries to perform the operation, and he practice those skills, and it is safe and controlled. So, and also AI algorithm helps in can generate 3D reconstruction of a patient autonomy for medical imaging, allowing surgeons to plan out simultaneous surgery in this. Uh, okay, and let me see. We have talked about wearable devices. So in healthcare, the wearable devices and virtual assistants are also playing a very important role in this. So let me just tell you about, I have another, Achal sir, we have another, how much time we have? 25 minutes, I think. I have
Yes, sir. Yes, sir.
25 minutes. Okay. So let me see if I can talk about a little more about the research which is happening out in a different part of the country. So we are we at my university people are working in mental health diagnosis, finding out what is a is it possible to find out because anxiety and mental illness is the important thing, which is from healthcare point of view is important topic of a research. So here at NSUT, there are a lot of research scholars who are working with me. We are trying to find out to find out with the help of wearable devices to diagnose the mental illness and try to work. Again, here also we are some of us are working with a lot of projects are there from Indian Council of Medical Research, where we try to see how AI can be applied in biotechnology area. So again, there is a group which works here in that area also into healthcare. So we have a strong thing which is from healthcare point of view. The biotechnology and computer science people work together. We have a course on biotechnology and bioinformatics and application of AI into that here. And there are a lot of students who are working into this. And let me tell about the real use case of one of my student. This student is she went to do her masters in US, and master after doing, she's working still in one of the reputed IT company. But 5 months back, she got diagnosed for her kidney disease. Now you know that kidney disease is, from healthcare point of view, is a very long, unless and until this. There are a lot of ways which one can recover it out and can follow that and recover it out. But 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 the amount of the time it takes for doing dialysis and all that, you have to, every time you have to visit the hospital. You have to visit the hospital and visit hospital maybe once in a week, or twice in a month, or maybe depending upon your disease thing, and or you have to do daily dialysis at the hospital and all that. So there is a huge list of patients which are there. For getting a kidney transplant, there is 2 years, 3 years, 4 years waiting list when you can get a kidney for a kidney transplant, which happens out. So this girl is suffering from for last 5 months. With the help of AI, can you imagine? Earlier, she used to visit hospital, and she's alone there in the US. Earlier, she used to uh, go to the hospital. Now, the hospital has given all the devices which are real time connected to the which are connected real time to the hospital, and these things are captured. What she does is, in the uh, night she start her dialysis process. Her whole room is full of those fluids and all that which are needed for transferring. And the once she logged into that dialysis thing, the her parameters goes into the hospital, and if there are certain things which needs an alert from the hospital, she is immediately informed. If there is something happens out to the machinery which is not giving a real time data to the hospital and all that, again that the person the manufacturer of the company is available 24 cross 7. This is available. So it is a huge suffering, but with the help of AI, at least she is at her home. In the morning she goes to her office, in the evening she is on the dialysis, which she does automatically her own, and try to perform those dialysis at home. And so in India also, there are a lot of patients who are suffering from kidney diseases and all that. There is very less space of dialysis which need to be performed at the hospital, and it is very tedious job. So I choose this study to just tell you what are the suffering, how AI is helping this girl, and then what is the research which is happening out in this, uh, what are the devices which are going to come and in near future, which are in a product in a research state. Maybe it may be launched somewhere maybe in few years down the line in India. And uh, and uh, there are a lot of uh, cases where they are trying to, because for each of the every devices in healthcare, one need to follow those regulators. So whatever in the regulation and ethics has to be followed, then only these devices are there. So let me see if I can just show you this thing. Uh, Dr. Achal, I
Yes,
Doctor. So I go to share and whole of the window I can show. I have on the
sir, you can make use
yeah.
of
I
Windows
will
if it
just
is open,
हाँ मैं
or you
I'm
can use the
मेरा उसी
screen.
पे ही
Yes.
है. I'm just going on to this and let me see patient care and kidney this digital living. Uh, uh, I'm sharing this girl. Let me see if it's audible.
Hello,
Yes, yes, sir.
10:30 in the night, and I'm ready to connect myself to the dialysis machine. Let me show you how it is done.
It's a 2 minute, 3 minute video.
This is my dialysis machine. It's by a company called Baxter, and I've got a hospital card from Costco Business Center to arrange all my supplies and machines there. I have some wipes to wipe the machine, some tapes, some applicators, some more tapes, and
So this is her
this
house
is a
where she has
liquid
kept this. I'm audible
extract
also, Achal
for
sir.
cleaning my catheter. Then I
Yes, sir. Yes, sir. You are also audible.
and here I have some 2x2s. And this is my 3 ml solution. It has around 1.5% extras. This is my bigger bag. Has about 6
So
ml
her
of
whole of the
solution
one room
and
is
again
completely
contain
filled with this
1.5%
liquids and all
dextrose
that.
or sugar. And if you look at the message here,
And
it
this
says
device is connected
check
with the
patient
hospital.
line, connect yourself. And this is cassette. And this is the patient line. And there is this. If you look at the bottom, there is a drain line going all the way to toilet because I don't use drain bag. I disconnect or I collect all the fluid directly in the toilet. So the machine is asking me that I connect this patient line to my catheter. You see, the one with the white cap is my catheter. So what I need to do is that remove the mini cap from
So
catheter
this
as well as the blue
so
cap
she is
from the
doing
patient
everything here.
line
It is
and
not possible
join
here
them
in India.
together like a
So
connection I have
in
made
the US
here.
they have allowed
And
her.
then I'll start the machine for the dialysis process to begin, and it will take about 9 hours.
So
And
whole of the
I
night
will
she's
keep you
there.
posted. Thank you for coming to my channel, and please do like, share, and subscribe to my videos,
So
and
so
let me know
so
what more content you want. Thank you.
so she
Here you can
she
see I have connected the
I'm
patient line
trying
with the
to.
catheter.
So this girl, oh, let me see. Let let me. So whole of the data when she does this dialysis goes to the hospital in the night, and if there are certain things which need to be there, which need to be looked at it, are required, the action is taken. So here still maybe I may be wrong in telling maybe it is allowed in US to do those dialysis here, but still people avoid doing this here at home. And I don't know, I'm not aware, maybe I can ask some of them whether they allow or here or not. So real time, if something happens out, the immediately the doctor takes him. So this is one of the use case which I just wanted to share with you, where this whole of this a patient sits at home, the data goes into the hospital, and they perform. And even this is she's also connected once this she switch on the device 24/7, the manufacturer is also connected with the device. If something goes wrong, immediately he takes the manufacturer take action on it. So let me show. So there is a university out in US, so it is working on working on, again, building up a device which can fit just like if you are aware of the pacemaker goes into the heart, near the heart. It is implant, a pacemaker. Same way, is it possible with the help of AI, a device can go into inside the body and can perform what we call it as uh, the dialysis for a kidney transplant patient. The maximum patient in whole of the Asia is in India. So this university is working on building up a device which which will go into your body, and you don't need whole of the infrastructure, and you can move around the way you move with your pacemaker, or when you get your joints replaced, and all those you can move around easily. So with the help of AI, they are building, and with the help of precision of a lot of electronics thing, they are building up these things by which it will go. Let me share out how they are building up this. Allow me to just project this a minute video to you, where we have also, I have asked my student to also upload her kidney story in that this research. So they are using this, she as one of the, her as one of the. So this is.
People living with kidney failure can soon look forward to a
Okay, Achal, it
future
is
without
audible?
dialysis or an endless wait for a transplant.
Yes, sir. Yes, sir.
Combining continuous treatment with total
Audible, sir.
mobility, the implantable bioartificial kidney will give patients back their health, freedom, and quality of life. The compact device will replicate many functions of healthy kidneys and will not require immunosuppression drugs. The bioartificial kidney combines a mechanical hemofilter to remove toxins from blood and a bioreactor containing engineered renal tubule cells to maintain water volume, electrolyte balance, and metabolic functions. Highly efficient membranes, constructed from semiconductor silicon wafers, enable filtration without requiring pumps or electrical power, while protecting the renal cells from rejection by the patient's immune system. The biocompatible device attaches to the circulatory system and removes toxins to the bladder as waste. After a decade of engineering development to refine the hemofilter and bioreactor components, preclinical prototypes of the implantable bioartificial kidney have been successfully created. Cleanroom microfabrication processes have been established to reliably produce high-quality silicon membranes. Tissue culture protocols have also been optimized to reproducibly grow renal tubule cells and maintain their function. The silicon membranes were mounted in polycarbonate housing to construct hemofilters, and in similar fashion, bioreactors were assembled to immunoprotect the renal tubule cells. The hemofilter and bioreactor components were then connected to create bioartificial kidney prototypes for benchtop and preclinical testing. In proof of concept experiments, the hemofilter operated under blood pressure alone, without systemic anticoagulation, while the renal cells in the bioreactor remained alive and healthy without immunosuppression. Further improvements will scale up the prototypes with additional silicon membranes and renal cells, creating clinical devices that can demonstrate sustained treatment of kidney failure in human trials. The implantable bioartificial kidney will provide the therapy and mobility patients need to move beyond the burdens of dialysis and organ shortage, and once again enjoy the freedoms of everyday life.
So this is again a project which is University of California in US. which they are building up. They have already have a prototype which goes into the body of the human being, just like pacemaker and all that. So the way my one of my student, you might have seen, daily she's and her time for kidney transplant is somewhere maybe 4 or 5 years down the line, she will be getting a transplant. Now before that, this devices which is being researched out, is being practiced out. Maybe she may be one of the candidate who may be getting this device on the clinical trials and all that. So her name is already listed out in this website. I will just share that also. You can just show she is one of my students. She is their kidney patient for San Francisco. You can just read out her story. And 12 days she was hospitalized. Again, she is relying on uh, the kidney transplant, which may happen out, and she is part of the kidney project. So this use case inspire everybody that AI is going to play a very big role in healthcare, and it has already played a bigger role. But again, there are a lot of challenges which need to be resolved at a government level, at a medical standards, and medical healthcare standards which need to be followed. Ethical issues need to be followed. So there are a lot of interaction which happens, and each and every government organization is taking a lead into it. So one of the Indian government, if you Google it out, AI site, India AI site, if you Google it out, you will find a lot of data sets which are available. You as a professor out in different colleges, or researcher who are listening to this talk, they can post their papers onto India AI portal, which has been created by Government of India, where they are putting a lot of data sets which can be used by this. Again, with the help of data security and privacy issue, AI in healthcare from India point of view is going ahead. So we'll see a lot of changes. We'll see a lot of advancement, which is going to happen here. So companies like there are a lot of companies which are playing very big role in terms of providing research from the point of view of healthcare. So these are Google, Microsoft, Meta, and a lot of Indian companies like TCS, Infosys, HCL. Again, they have their life sciences group also, which are doing research and all that. There are a lot of, as I have discussed, there are a lot of challenges which need to be resolved. Another thing, who are solving these challenges which are there are a lot of startups which have come, and the government of India and other people, private players also are giving funds to these startups in AI healthcare. uh, uh, like with the coming of 5G 6 5G, there 5G, the mobility and getting that data is becoming easier and easier. With Government of India building up a lot of data centers around whole of the country, the healthcare is becoming more and more affordable from government point of view. And with more and more digitization of electronic record, again it is helping in this. So there is a lot of push from Government of India to push AI in healthcare, and see to it that there are a lot of national level projects which are being given by DST, DBT, and other people, who funding agencies, which are being given in hub and spoke model, where one of the organization become as a hub, maybe IIT or any of the university becomes as a hub, and then there are several spokes of engineering colleges and medical institute, or it may be in the form of a pair where there may be, or it may be in a pair format, or it may be where two of the industry academia partner themselves and try and implement. So government, from government point of view, there is a lot of push and lot of help which they are providing to all the organization and the researcher. Same way, ICMR is also helping this in building up a lot of data sets. They have a huge data set which the researchers are using for this. So if you see the whole of the country, there are a lot of data sets which have been published and all that. Please allow me to show you one more 2 minutes video, which is from Google, where Google and Apollo have used together to form together to see to it how the tuberculosis can be irrigated, can be removed from India, and they are helping out in. I will take, please do let me know, Achal sir, when I need to stop.
Okay, sir.
So I'm sharing with this uh, Stanford Medicine.
Artificial intelligence can spark either hope or hesitation, especially when it comes to healthcare. But it's already being utilized right here on the Stanford campus and in clinics, from cardiology to ophthalmology. How is AI, the algorithm, used in your clinic?
In the past, when most people think about individuals who care for their diabetes, you're thinking about poking your finger and getting a blood drop and putting it on a meter, but that's not the case anymore. Right now, most individuals living with diabetes, they get to have a continuous glucose monitoring, and it gives them 288 data points in one day. So as clinicians, we're trying to really understand and wrangle all that data, and AI has really helped us do that.
So AI speeds up the process because you get the results in real time and you can reach out to these patients in real time.
As soon as that refresh button is hit on this screen, those people who need the priority, they just go right up to the top. And there's actually a lot of data that shows that when you have technological advances in diabetes, our most minoritized families are left behind.
So the AI has a far better outreach to these underserved communities.
Exactly. It helps us get to those communities faster. And that's all because you're able to prioritize through this dashboard that we've created, and it floats people up right to the top.
So AI is a term that people use a lot these days. How is AI used in this aspect when you're diagnosing a patient with a cardiac problem?
These kinds of ultrasound videos, like the one that Deb's taking now, there are tens of millions of these done every year just in the US. It's a very routine way for doctors to assess how well the patient's heart is functioning, whether they are at risk for stroke or heart failure. Where the AI can come in is that the AI that we develop is a computer vision-based algorithm that can look at these ultrasound videos and then help the doctor to assess what is the condition of the patient's heart.
So it's another tool in the doctor's toolkit. It's not necessarily taking any treatment away from the patient.
That's right. It's just a tool that helps to inform the doctors quickly as to what is the condition of this patient.
So I'm identifying here a small macule. I'm going to take a closer look at it on dermoscopy. And then I can bring a smartphone over and capture the image. The algorithm will be able to analyze the image in real time and produce an output, whether or not it needs to be biopsied.
So it's speeding up the process, in other words.
Yeah, and automating it as well.
So Dave, explain to me how AI is involved in this process of screening diabetic patients.
It allows patients who are seeing their primary care doctor for their normal health check to get an eye exam for diabetic eye disease while they're here. So they don't have to schedule another appointment. That photograph is immediately interpreted by the AI algorithm. If they're positive, then they're immediately referred for an in-person eye exam.
How significant is the use of AI in ophthalmology, especially with diabetes patients?
I think one of the largest problems that I see in my daily practice as a retinal physician is that patients with diabetic eye disease present later than we would like to our clinics, often with irreversible vision loss. So being able to detect the disease earlier and then being able to intervene at the earlier stages when we can actually turn things around, preserve vision, I think is really important.
With all these technologies involved, safeguards are in place. That's where Stanford's Raise Health Initiative.
So let me stop here. So you might have seen that Stanford, Harvard Medicine School, same way AIMS, and all these people are really working towards making healthcare accessible to the people who are not able to afford the private hospitals, or not able to even have a reach to the government hospitals. So the AI is helping us to reach to the farthest, the person who is staying far away from the place, or he's not able to afford. So they are making. But again, as I've already told, that there are a lot of challenges which are there with the AI, which we need to look at those challenges. But with the advancement in AI, the things are becoming better and better, and helping healthcare fraternity to progress. Like doctors, they are using all these tools, like just like you have seen diabetics patient, or retina checking, or maybe heart cardiologist patient, or a person who has a damaged kidney, how they are being recovering with the help of AI tools. So there are a lot of research which is happening out. One we did with AIMS, where the All India Institute of Medical Sciences, we coordinated with All India Institute of Medical Sciences. They wanted to test, like most of the people have a vitamin D deficiency and all that. So we collaborated with AIMS and did a trial here with the students using certain AI tools, and we were able to get certain results which the doctors sitting uh, in AIMS were able to analyze and use. So there is a lot of research. So with this, I end my talk here. On behalf of my university, I thank Professor Achal for inviting me for this FDP, and I wish this FDP all the best, all those learned professors and people from industry. I see a good people coming from industry also in this FDP, and I hope there are a lot of takeaways from this talk, and I will be open for any questions which you have, or maybe some later on also, whichever way. Thank you, sir, for inviting me.
Thank you, sir. Any questions? I mean, if from the participants you have any question, you may raise your hand. We will unmute you.
Okay. Okay.
Deepak ji, you may ask the question.
So good evening. Deepak Sonkar बोल रहा हूँ गलगोटे यूनिवर्सिटी.
हाँ जी दीपक जी, how are you?
Okay, I'm fine, sir. Thank you so much. So, my question is that in artificial intelligence, it's a very big and vast field. Okay, so IoT is one of them, and in medical sciences, IoT devices playing a very important role. So, my question is that while treating to a patient with the help of IoT devices, is it safe?
Yeah, it is. See, the companies like Philips and GE, all these companies are making the devices. And whenever any signals are pushed out of these devices, they follow all those protocols which the real time data it has to come. So it is I will not be able to say whether it is the IoT devices are safe or not, but yes, until these are safe, until and unless it doesn't harm the patient, and it gives the data the way the doctor needs in a real time. For example, you have a wearable devices like I watch, the watch, Apple Watch, or you may have You have a pulse rate problem. You wear certain devices here, and your IoT devices, it is giving a info. It is giving some data to this doctors in a real time. Then it is safe. It has to follow IEEE standards and other standards which the medical instruments which are made, and once it follows those, then these devices are safe. But again, from research point of view, there is a huge amount of research which is happening out in IoT plus healthcare. It's a huge research is happening. Thank
Sir, yeah, thank you so much for giving me the answer. But my question is just a little bit different. I'm asking in respect of hacking because the IT
Oh,
devices
okay,
just works
okay.
on the internet. Yeah.
Yeah, yeah. So you are right. You are right from hacking point of view, and all that. Whenever these devices are made, this devices has to follow up. Again, I told wherever the server is there, the server has to be protected as per the Cybersecurity Act. So if it is not protected properly, the data may be hacked. You are right. You are perfectly right. So this is one of the challenge. This is one of the challenge how
Yes,
to,
sir.
because
Yes,
day
sir.
by day the advances are happening one time here, but other side the hackers are also trying to do something by which they are able to fetch those signal. Again, you are right. This is a challenge. This is a
Yes, sir.
challenge. Yeah.
Okay.
Thank you.
Okay, okay, sir.
It
Thank you,
was
sir.
a good
Thank you.
question.
Vinayji, you may ask your question, please. Okay, I guess, I mean, there is some connectivity
Okay, no
issue with
problem.
him. Right. So I
So thank
guess,
you. So I can leave, Achalji?
yeah.
Yeah, thank you. I will leave.
Thank you very much, sir. Thank you
Thank
very
you.
much for the
Thank you.
session.
Thank you. Thank you for inviting me, and all the best for your this FTP, and all the best. Thank
Thank
you.
you, sir, for this engaging and thought provoking session. With this, we move on to the second session of the day titled AI based motion control. The session will delve into the applications of AI in motion control systems with a focus on robotics, automation, and the broader implications for the technological innovation.
We are privileged to have Professor Prerna Gaur, professor at Netaji Subhash University of Technology, Delhi, as our esteemed speaker. With an illustrious career spanning over 32 years, Professor Gaur is a distinguished expert in AI and its applications in engineering systems.
Thank you, Professor Gaur, for being with us today. We look forward to learning from your vast experience and expertise. Over to you, ma'am.
There is some connectivity issue. Ma'am is joining in a while. Please wait. Okay, meanwhile, I would like to apprise all the participants. I mean, making and marking attendance of the session is again a very tedious job at IIT, IICT portal. I mean, related to individually, we have to mark presence for every individual. And after ending of the session, it becomes very late to mark 170 or 180 odd attendance. So we generally do it on the next day. And while marking out these attendances, I mean, because we generally get it for all the unverified or the external sources, it need to be verified from your email, and it becomes very difficult at times. Because for that reason, we wish you to join through your registered email, because that becomes very easy for us to mark the attendance. But somehow we are trying to do it. I mean, in case there is any issue, you can send a message. But again, repeating, I mean, please do read the messages what is being there for you people, because it was very clearly mentioned that we have marked attendance of one day, but so many messages actually spam out the group saying that your attendance the second day is not marked, and it becomes very difficult for finding out the genuine cases or the genuine reasons. So I request, humbly request, that please go through with your with the messages that is being there relevant for your cause, and accordingly act. We are there to help you. I mean, it is something mutually we need to look into it, but please have patience out of it. Thank you.
Now, we are privileged to have Professor Prerna Gaur, professor at Netaji Subhash University of Technology, Delhi, as our esteemed speaker. With an illustrious career spanning over 32 years, Professor Gaur is a distinguished expert in AI and its applications in engineering systems.
Thank you, Professor Gaur, for being with us today. We look forward to learning from your vast experience and expertise. Over to you, ma'am.
Achal Kaushik, and all faculty members and other participants available today attending this FDP. I can see there are 174 participants. It's very good that at this 11th hour, actually it's going to be only 7:30 or 7:45 and all are here. So it's my privilege to be here. Thank you so much for inviting me. And I just share my PPT here. My screen is visible to all? Hello?
Not yet, ma'am, not yet.
Oh, share entire screen. So now it is available?
Yes, ma'am, yes. Yes,
Okay.
it is visible.
Okay. So AI-based control applications in power electronics and drives, that means motion control. I am basically from electrical engineering background, and my PhD and my scholar's PhD is basically in AI-based control applications, whether it is renewable energy or motor control or drives or some medical equipments where robotic surgery is being done. So my this presentation is based on those research by myself and my scholars. So I will start with this slide because why we need motion control. India's commercial energy demand is on the rise, and this demand is on the rise because we are harnessing the energy for various electrical applications where motor control is one of the thing, and mostly in all the countries all over the world, government is funding for changing the scenario from fossil fuel to renewable energy due to this demand. India has low power per capita energy and electricity consumption and also CO2 emission. So these are some slides which are showing the data of India with respect to other countries. And there was a mission 175 gigawatt by 2022, and I am happy to say that by 2022 we had generated power more than 175 gigawatt, that is 220 gigawatt. So this was because of some policies taken up by the Indian government. and National Solar Mission was launched on 11 January 2010, and according to that, 20 gigawatt was forecasted by 22, but 220 gigawatt finally we could able to generate. And in June 15, the targets were scaled up to 100 gigawatt, but finally what I say that 2023, the report came that 222 gigawatt power was harnessed through renewable energy. Role of policy and regulation in renewables growth, because we are using electricity, so we have to see the from where this is coming for the control applications also, and because I am in power, so we are actually working on this area also. So you can see the role of policy and regulations in renewable growth. It started way back in 1993-94, where nobody was knowing, nobody like us were knowing that power can be harnessed from PV cells and the wind energy systems in large capacities. And in 2002 and 3, when I was searching what topic should I take for my PhD, and I thought about renewable energy as an area, but at the time it was actually through literature survey I came to know that if I go with this as a my research topic, it is very costly affair, and power generated through PV cell and wind energy system is very costly, and nobody will actually finally take it as a research. So we should not go into the renewable energy area. We should do some motor control and AI based control. But today, if we see that with the policies and with the available material in the Indian market, the energy harnessed through PV cells has come down to around 2 rupees, and that is less than the tariff which we get from the energy received from generated from fossil fuels. So
Excuse me,
you
ma'am.
can see.
Ma'am,
Yes,
Prerna, ma'am.
yes,
Ma'am,
yes.
there is some issue, I guess, with the bandwidth. I mean, the slides
Oh,
are not properly visible.
okay,
So,
okay.
I mean,
Now, can you now see
um,
my slides are visible?
ma'am, actually, I believe, I mean, there is some bandwidth issue because it is coming and it becoming blurred at times. Now, I mean, at this point, it is okay.
Actually, it was not slide mode. Now it is slide mode also. Can you now see my slide properly?
Ma'am, yes, ma'am. At this point of time, it is visible.
It is
I mean, in
this
case, I mean,
first slide is on slide mode. Otherwise, earlier it was not on slide mode.
ma'am, it is still getting blurred. I mean, if you can switch off your camera, I
Okay, I will
guess, I
do
mean,
that. I will
bandwidth
do
will
that. I
work,
will do
right?
that also. Actually, my internet has a very fast and high speed internet, but how it is giving the trouble, I don't know. Actually, हम MS Team बहुत कम use करते हैं. किधर है कैमरा इसमें? Record, share. Which side I will find the camera?
What is at the top? I mean, we are not able to see even your screen right now.
Oh. अच्छा अभी तो मैंने ठीक है.
Right.
Okay, now
Yes,
camera
yes,
is visible.
yes.
Okay. Now I again come to the slide which I was. My slide is visible now.
No, ma'am.
No.
No.
Actually, what should I do? Stop share करूं? Cancel. Okay, I will download this PPT. It was in my this drive. I will download. Just give me 1 minute.
Yeah, sure, ma'am.
On my laptop, then I will share it. Copy. I am on sharing mode now also.
Yes, ma'am. Yes, ma'am.
Okay.
I mean, if possible, if you can restart your internet, that may work because I do believe there is some issue, it seems.
तो मैं डिस्कनेक्ट होंगी फिर 2 मिनट के लिए.
हाँ मैम, हाँ, right, right. Ma'am, you are still in a sharing mode. I guess you have made screen share.
I was disconnected for some time.
Okay, ma'am. Yes, ma'am. Please.
मैं डिस्कनेक्ट हुई थी क्या थोड़ी
नहीं
देर
नहीं नहीं हुए मैम, नहीं हुए.
अच्छा, so now I have downloaded and I will share it from my desktop and then kindly let me know whether it is visible
Ma'am,
to.
in fact, at this point also it is not very clear. I mean.
तो मैं एक बार दोबारा लीव करके ज्वाइन करती
हाँ
हूँ.
मैम, right.
पहले कनेक्टिविटी में ना. Can you find any difference now?
हाँ मैम, yes ma'am.
So share किधर है? I have to share window or share screen?
Ma'am, you can do anything. I mean, it will work fine.
अच्छा. Share entire screen. Now my screen is visible?
Yes ma'am, it is visible.
पहले से better है?
मैम ब्लर्ड ही आ रही है अभी भी थोड़ा सा.
So I should shift my location from here. I have come near to the master connection. वैसे connection का भी issue तो नहीं होता. How it is coming today, I don't know.
हाँ जी मैम, आप पीपीटी मेरे को शेयर कर दीजिए. आई विल शेयर. आई मीन इन दैट केस इट विल फाइन.
अच्छा. आई एम सो सॉरी कि कनेक्शन की इशू आ गया. ये आवाज क्या आ रही है? आपके यहाँ से आ रही है क्या डॉक्टर अचल?
नो मैम.
देखिए मैंने आपको शेयर कर दिया व्हाट्सएप. कैन यू शेयर इट नाउ? मिल गया आपको डॉक्टर
नहीं
अचल?
मैम, अभी नहीं हुआ है मैम. अभी नहीं आया है.
व्हाट्सएप पे?
हाँ, अभी नहीं आया मैम. मैं आई गेस कनेक्टिविटी इशू है, शायद इस वजह से नहीं आ रहा हूँ आपकी वैसे।
ओहो, हाँ हेलो।
हाँ जी मैम।
अभी आया आपके पास?
हाँ जी मैम, अभी डाउनलोड हो रहा है।
मैंने दूसरा इंटरनेट ऑन किया।
आई गेस आप ट्राई कर सकते हो, अभी आपकी फोटो भी ठीक आ रही है।
हाँ हाँ, एक्चुअली आई चेंज द इंटरनेट। एक सेकेंड।
There would be issue, I will share now because
Can you now check whether my screen is visible to all? Dr. Achal?
ma'am, screen is visible, but it is
Visible
still
but
not very
blur
clear.
है मैम।
अभी भी ब्लर है? तो आप अपनी तरफ से शुरू कर लीजिए। मैं उसमें से बोल सकती हूँ, क्योंकि वॉइस तो क्लियर है ना? वॉइस तो क्लियर है ना? लिया हुआ है। मैंने कहा वॉइस तो क्लियर है ना
Yes,
डॉक्टर
ma'am.
अचल?
Yes, ma'am. Yes, ma'am. Voice is
तो
very
फिर
clear.
आप
Ma'am,
screen-
I'm starting, ma'am. Just give me a second.
ऐसा हुआ नहीं कभी, ऐसे पता नहीं क्यों हो रहा है अभी आज।
I hope now screen is visible, I
now,
guess, right?
yes, now it is clearly visible to me. I can see,
Okay.
so I think participants can also. So
Right.
basically, I started in my previous PPT. There was some slides on renewable energy also, but this is particularly later on in that PPT also. These
Okay.
slides were there. So now AI-based motion control is the topic. It is the current topic which you announced. So I told that my electrical engineering area allows me to apply AI on motion control. So this is you can come to the next slide. This is what myself and my students have done in their PhD and MTech. You please share the next. Can you actually share on larger area on the screen? Uh, can
Yes,
you?
ma'am. Yes.
So techniques include such names as fuzzy logic, artificial neural networks, genetic algorithms, and expert systems. AI is a family umbrella that loosely links these techniques and separates them from traditional computing methods. Each mimics some aspect of intelligence, human problem solving, learning, knowledge, or evolution. So current slide shows some robotic arm is performing some task on a car, assembly line of a car. So similarly, one of my student has done some research on robotic arm used for surgery. So using AI. Next slide. So the first practical steps towards AI were taken in the 1940s. Today, AI is reaching a historical moment because of 6 converging factors. Bigger data. So you can see now there are some devices to store this bigger data, and data has become bigger and bigger. So many devices have given us access to vast amount of data to process, both structured in database and spreadsheets, and unstructured such as text, audio, video, and images. So this these forms we can have the data and large data. As trillions of sensors are deployed in appliances, packages, clothing, autonomous vehicles, and elsewhere, big data will only get bigger. So AI-assisted processing of this information allows us to use this data to discover historical patterns, predict more efficiently, make more effective recommendations, and more. So similarly, the second aspect is processing power. You can see that we started journey with microcontrollers, and now microprocessors, and now we have very high speed processors. Accelerating technologies such as cloud computing and graphics processing units have made it cheaper and faster to handle large volumes of data with complex AI empowered system through parallel processing, deep learning chips, a key focus on research. Today we push parallel computation further. And third one is a connected globe. So today, if you can recall, in first decade of 21st century, we were actually astonishing how the Western world is predicting the weather. Now the globe is connected, and through satellites and other things, we have the data available for any place sitting at our place. So the global manufacturing supply chain together with social media platforms have fundamentally changed how individuals interact and what information they can expect and when. Increased connectivity is accelerating the spread of information and encouraging the sharing of knowledge, uh, uh, including open source communities developing AI tools and sharing applications. So, due to connected globe, there are some actually aspect which are which are there where AI solutions from AI will be better and faster. Next. Open source software and data. Open source software and data are accelerating the democratization of the use of AI, as can be seen in the popularity of open source machine learning standards and platforms. The open source approach can mean less time spent on routine coding, industry standardization, and wider application of emerging AI tools. Nowadays, Chat GPT has come. You can see everyone is saying that now there is no need of the a person who is good in coding, because Chat GPT can give you the solution in minutes, in seconds, and some other things. If you are preparing something, you can ask Chat GPT, and through AI you can get everything on your laptop within seconds. So such is the time is today. Improved algorithms. Researchers have made advances in several aspects of AI, particularly in deep learning, which involves layers of neural networks designed in a fashion inspired by the human brain's approach to processing information. Another emerging area of research is deep reinforcement, in which the AI agent learns with little or no initial input data by trial and error, optimized by reward function. So such are the uh, areas where we can apply, we can use our skills in the AI field. Next slide, please. Next slide. It is hanged. Hello, Dr. Achal.
Just a second. Actually, I just tried to put it on the MS Team itself.
MS team means?
Uh, मतलब, yeah.
जैसे भी चल रहा था वैसे ही कंटिन्यू करने देते।
No, it would give better impact. Just give me a second.
हाँ हाँ हाँ, क्योंकि ठीक चल रहा था अभी तो।
अभी भी ठीक चलेगा मैम.
ये AI को
I hope it is visible, right?
हाँ हाँ, विजिबल है. Actually, I have a fever for the last 2 days, so I was thinking how I will manage.
Oh,
Mm-hmm.
I guess it is visible, right, ma'am? Right.
Visible, sir.
Visible.
So it is
आपके
within, it is actually embedded now MS Team itself. I need not to actually switch and do anything.
Okay.
Okay,
So
thank
I
you.
can also then go to next slide. I can
Yeah.
also do.
Ma'am, I need to see. I mean, I haven't used it,
Okay,
but yes,
no issue,
if you
आप
can
ही करिए.
take the access, you can do that.
अच्छा. Experts, now I start. Actually, it is taking some time. Experts expect that supervised and unsupervised learning techniques will become increasingly blended, and that such hybrid techniques will open the way for human machine collaborative learning and AI to develop more advanced human like capabilities. The convergence of these factors has helped AI move from in vitro in research labs to in vivo in everyday lives. So established corporations and startups alike can now pioneer AI advances and applications. Here I can recall one student who came to us uh, 1.5 years ago with some very novel idea. He was saying that, Madam, I have a coding, I have an app where you just give me the topic and what you want in that document. It will actually generate a paper for you or a SOP for you or LOR for you. Before the chat GPT was so much actually known to everyone, he was having that solution with him. But now you can see within 2 years how this thing has come up, and everybody now actually knows that to generate something, whatever has to be presented, it can be generated through chat GPT in seconds. So this I prepared 3 years ago, but now things are coming in that way. So next, please. Next slide. So automated intelligence systems that take repeated labor-intensive tasks requiring intelligence and automatically complete them. Resistance welding is one example. Resistance welding used to be air or hydraulic driven with sensors, and that the robot or to squeeze to give given pressure and fire the current. The result was overwelding on scale of 30% on average according to FNAUC North America. This is a company name. So with the luxury of a developmental R&D lab that brings to bear emerging research in robotics, linear motors, CNC controls, sensors, and in industrial applications experience. One of the latest results is what this company calls learning vibration control. So next slide, next slide, please. So automated after automated intelligence, there is assistance intelligence, systems that review and reveal patterns in historical data, such as unstructured social media posts, and help people perform tasks more quickly and better by using the information gleaned. For example, techniques such as deep learning, natural language processing, and anomaly detection can uncover leading indicators of hurricanes and other major weather events. And third one is augmented intelligence, systems that use AI to help people understand and predict an uncertain future. For example, AI enabled management simulators can help examine scenarios involving climate policy and greenhouse gas emissions. Fourth one, autonomous intelligence, systems that automate decision making without human intervention. For example, systems can identify patterns of high demand and high cost in home heating, adapting usage automatically to save a homeowner money. So these are some areas where we can go for our research, further research. Next, please. Next slide. So I come to my research part. I don't know, participants are from electrical engineering or from computer engineering or IT, but I will relate my research to everyone so that they can understand. This is the PMSM large circle, that is permanent magnet synchronous motor. It is it is servo motor, and very precisely we can control anything using this motor, like missile and robotic or bomb. Actually, this motor can give you very precise control, and if we use this motor, we can reach the target within fraction of second. So every actually such things like missile and robots, sorry, uh, uh, Chandrayaan mission, everyone is using PMSM, and load is whatever load is connected to that application will be that, and resolver is taking the current position of this PMSM, and here you can come at the left side where reference speed is there. So we want to run this motor at at the speed which we want to run. So reference speed is that speed, and if a resolver is giving us the current speed. So in the left side, plus and minus, the error between reference speed and current speed is taken from here, and then that error in between the speeds. Suppose we want to run motor at 700 speed, and from the resolver it is coming 400 RPM. So 700 minus 400, 300 RPM is the error, and speed controller will reduce this error very fast. And after the speed controller, there is a limiter. Limiter will keep all dimensions as per the specification of the motor, because motor is electrical and we can send only the rated current and rated voltage. So here the current afterwards will be within the limits, so that motor cannot burn. So this limiter is applied here. So again, two phase to three phase conversion. If you have been in electrical or any type of mathematics you have studied up to your 12th class, there is two phase system and three phase system. This PMM SMS three phase motor, but this is in actually it is three phase motor, but in computer to make the thing simpler, because three phase is 120-degree apart every signal, but if we take three vector quantities which are 120-degree apart, we can the calculations become very complex. So to make it simpler, we convert three phase to two phase. So two phase is 90-degree apart system, and when two vectors are 90-degree apart, these do not actually interfere in each other. So this conversion block is inside the computer, and we have converted all three phases into two phase inside the computer. We have done calculations in two phases inside the computer, and the complexity has been reduced. And finally, in this block, the three phase currents, you can say IA star, IB star, IC star, is being sent to the inverter, so that inverter can give us the supply which is fed to the PMSM, permanent magnet synchronous motor, in that amount which can run the motor at the desired speed 700 RPM. So this is the total scheme, and on which I worked in my PhD thesis. I applied several controllers in place of speed controller. There was some old actually fashion control, you can say PI and PID, and later on I shifted to fuzzy logic, the neural network, and the recurrent neural network speed controller to actually get to run this motor at the desired speed. So next slide, please. This what I have explained is known as vector control of PMSM. If somebody amongst you is mechanical engineer and you have worked in CNC machines and other things, so vector control is a technology where actuators are being controlled through this technology nowadays. And if you are using air conditioning systems at your home, or this latest fridge refrigerators in your home, and you see the 5-star marking or 3-star marking. So this is recently introduced in fridge and air conditioners. This is because of this vector control technology being applied to the to control the motor inside AC and fridge. So this vector control technology can run the motor at a desired speed so that desired temperature can be obtained directly, controlling the speed. So and at that controlling directly the speed to give the desired temperature saves energy, lots of energy. Earlier in when it was star rating was not marked on these compliances, motor used to run at same speed, and the control was control on the temperature was through reduction in the uh, voltage and control voltage and current ratings. So that incurred heavy losses in the system. But now we are controlling the speed of the motor in such appliances, and by speed control we are reducing the temperature accordingly. So precisely speed is controlled, precisely temperature is controlled. So this line diagram which you can see is the diagram inside. If some power electronics engineer can understand it, there is a inverter. Actually inverter is the device which converts DC voltage into AC voltage, and for permanent magnet synchronous motor we require AC voltage, and this AC voltage to PMSM, permanent magnet synchronous motor, should be at the desired current and desired voltage, and this is the job of inverter, to provide the desired speed and desired current, desired voltage and desired current, so that the motor can run at the desired speed. So any other thing is helping this inverter to trigger at that particular time, so that it can generate required amount of voltage and current through inverter and supply to PMSM. Next slide, please. So this is another line diagram, and only electrical engineer will be happy to understand this. Next diagram. Next diagram. Next slide, please. So yeah, can you please remove this record has started, black is coming on the top. Can you remove this thing? Half of the slide on the upper part is not visible because of this.
I'm not able to find it out. I mean, if any participant can confirm, because for me it is visible, ma'am.
अच्छा लोगो कुछ आ रहा है, रिकॉर्डिंग हैज स्टार्टेड, पूरा ब्लैक आ रहा है, एंड ऊपर का पूरा स्लाइड नहीं दिख रहा मुझे.
क्लियर है मैम ये मेरे पास.
मैम वो रिकॉर्डिंग एज पे आप ओके कर दीजिए.
मैंने कर दिया, मेरे में आ रहा था, मैंने कर दिया. सो मॉडलिंग एक्चुअली फॉर controlling the motor, we should have simulation model. So these are some constraints, assumptions made for modeling of the synchronous motor. Next slide, please. So modeling of conventional controllers, I told that initially I did with PI controller. So it has some equations, and for simulation we need equations. So these equations were realized in MATLAB. Next slide, please. Then again, next controller I used in my thesis was PID controller. So everybody knows the equation of PID controller, and this is the MATLAB model in the for the PID controller. Next slide, please. Third controller was sliding mode controller. This was faster than the previous two, and there was actually tuning of the controllers is always required, so that desired amount of current and voltage can be generated finally. So tuning gains are there in this sliding mode controller. Sliding mode means a trajectory, predefined trajectory is there. So for any speed, if speed is changing rapidly, we will define the trajectory for the change in speed, and our reference is that trajectory, and actually the controller will follow that trajectory if it is tuned perfectly. Next slide, please. So this is the MATLAB modeling of sliding mode controller, and here S1 and S2 are defined by these equations, and K1 and K2 are the gains. Next. So after designing conventional controllers, we move towards modeling of artificial intelligence based controllers for PMSM drive. Same drive now will be done with the help of AI based controllers. Next. So first one was fuzzy logic controller. I did it in 2003-4, and now nowadays also students are doing it, and everybody knows that for fuzzy logic controller we have to write rule base, and PMSM is our output. Output is seen as C. Input is reference speed, and in between this, actually, what I showed in the previous slide was PID and mathematical modeling. But if we are changing it to the AI-based controller, there is no mathematics required. There is a black box, and input and output are known to us. We will just tune our system with the help of input output and some algorithms, and that input and output will be taken from the previously set examples like PID controller. So input output will take from there, and we will accordingly we will make our rule base, and the rule base and the data coming from input will be fuzzified first. Then due to available rule base, some control will happen inside the FIS editor, and then after something is coming out from the FIS editor, we have to defuzzify it, and then some gains are there to be multiplied with that output, and finally the crisp data will be sent for the output. Next. So it will be treated as I told you, that black box error between actual and reference speed, which I explained in my first slide, and output is the speed controller as IQ of that speed controller. In the first slide was output was IQ. So this fuzzy logic controller, if I will make using fuzzy FIS editor in MATLAB, it will give us output as IQ while taking input as error in speeds, and it will be a black box. Black box means we don't need mathematical modeling. Next. So a Simulink model of fuzzy logic controller. So it is easy to make it, but tough to tune it. So tuning is very tough. You can see gain 3 is very easy to find out, because it depends upon the error and the amplitude of error. But derivative gain and saturation gain are very tough to find out finally, and gain 1 is also very tough. So it takes hours and weeks to tune a fuzzy logic controller. Next. Fifth one is ANFIS, Adaptive Neural Based Fuzzy Inference System Controller. So this is the controller where we have to write rule base, and we also have the architecture like neural network. And in neural network, if somebody has done it, there is algorithm, there is input and output, and some architecture, and algorithm is there, backpropagation algorithm and other algorithms to give learning to this system. So after learning, it sets its weight, and finally it is better than fuzzy logic controller. So for our inputs, it will give us better output results. So it has both the things, fuzzy logic as well as neural network. Neural network apart, we have to design architecture, and fuzzy logic one, we have to write rule base also, and neural network there is weight training also, so it is also done here, weight training. Next. But it's easy for researchers like us, because tools are available in MATLAB and other softwares. So we need not to go in detail. But if we are doing actual research, so actual research means if we are finding out finding out ANFIS controller only. We have to design ANFIS controller only. Then we have to think about how architecture will be defined, how the rule base will be written, and how the gains will be tuned, and how the backpropagation algorithm will be applied on it. But if we have other goals, then this will be taken as a tool. So Simulink model for neurophysics speed controller is available in MATLAB, and you have to tune it for your parameters. Next. So here a neural network controller, here you can see if it is a 4 input system and 1 output system, this will be the proposed architecture of a neural network. It has got three layers. One is input layer, and another is output layer, and there is hidden layer. So hidden layer depends upon how much accurate you want your output and how much your processing unit is comfortable with to deal with the larger data. So large number of hidden layer will give you good output, but you need to have a fast and better processor which has the better storage, better RAM, other things. Next, or workstation. So training of neural controller to emulate actual controller. Actually, you can see there is a controller which you can see which you can relate with my speed controller in my first slide. Plant is PMSM. In my first slide you can correlate with that, and we have designed a neural network which has some architecture, and we can tune this neural network with the data which we fed earlier in PI or PID controller. The same data will come here also, neural network, and some feedback mechanism will be applied, and this neural network will learn itself, and then it will generate its own black box like a controller, and that controller will be better than the previously used controller, like for the same data. So this is the explanation of that thing. Next. So this is my first slide, MATLAB model of my first slide, that was the line diagram. It is the MATLAB model. So here you can see permanent magnet synchronous motor is written on a square, and same things. PI is the dead speed controller which I shown you in my first slide, and input and output two boxes are there. These are going to two workspace. So in MATLAB, if we take these two uh, uh, you can say symbols from that MATLAB, this data from these two boxes are connected input at the input and output of the PI controller. So this input data is stored in my workspace at some column, and output data is also stored in my workspace in second column. So I have retrieved that, I have stored this data to train my neural network controller. So with this data, the architecture I have shown of a neural network, that architecture had one input and one output, and that was trained with these data. And finally, you can see the regression graph. It is best fit regression graph, and there are these blue dots. These are the dots and very much aligned. And if you are actually tuning the neural network, you will find that every time there will be different result. So if you get this type of result in one of the iteration, you should save that, because in a next iteration you will not get the same result. So this was very hard earned graph for me, and I saved it, and this actually gave me very good result. Next, please. So this blue box is the outcome of that MATLAB model as a neural network. I designed my architecture and with using back propagation and input and output data. I tuned that neural network. Finally, this MATLAB block was generated. This can be used as a neural network block. So I replaced PI controller with this blue neural network controller. So rest the things are same, and this neural network gave better results than the PI, PID, and sliding mode controller. Rest of the things are same. Here, green is the thing which can be used to see the result. This is known as scope, and from scope you can see the result of speed and control and torque, current and torque. Next slide, please. So recurrent neural network. So this is better than neural network. Here you can see there is feedback from the output. So feedback is given for the betterment. So weight training is better when you get feedback from the output. So architecture, there is slightly different architecture. Here feedback is connected to the input and giving you the better results. But tough to model and tough to find out the gain. So next, please. Rest of the things are same. So similarly, if you have this model in MATLAB, matlab you have make this model in MATLAB, you have to run the algorithm to tune it and to learn it. And after learning, this blue block will be generated, and same input and same output. Say you have to tune it. After tuning, you will get this blue box. Next slide, please. Next slide. So this was my motor. When we are working on a motor, we should have the defined parameters so that we can find out the gains tunes get gains tuned accordingly, and these should be specified for further research. Next, please. So these are three graphs, and you can see that first one is for PI speed controller, second one for PID, and third for sliding mode controller. So upper one is the angle on which current motor is rotating. The middle one is the speed graph, where you can see the slope. First slope is there, motor was started and reached the speed of 300 rpm. Then again it was reversed and reached to minus 340 rpm, and then it remained at 340 rpm. So when the speed was gained to 340, remained on 340, then reversed on 340, you can see the angle is also reversed on the upper row. And similarly, the third one is the torque, because I am not in front of you and I don't have. Can you see my this arrow? Arrow cannot be seen. Huh? So torque torque is the third one. So initially, when motor runs, torque is high. When motor takes its 340 rpm, it becomes rated. Then when reversal is there, torque becomes negative, and then for 340 pe it again becomes same normal torque. Then when the load is increased in the last last 0.1 to 0.12 second, again torque is increased. And similarly, when torque is increased, current will also increase. So three phases on the bottom row are the current, is the current for all three controllers. And circles जो दिख रहे हैं उनमें, that is the time taken to reach that speed. So time taken in PI, PID, and SMC can be compared, and SMC is the faster. It is the speed is reaching 340 rpm, very fast in SMC. It in 0.01 seconds. Next slide, please. Similar graphs you will see now. So PI speed controller for reaching the speed from 340 to 740, and for all three controllers, and the circles can be seen to compare these results. So SMC is faster among all those. Next, please. And again, at very high speed, motor is of the 700 rpm, but we run the motor at more than the 700 rpm, that is 1000 rpm. Still the motor was running satisfactorily, and reversal is also seen satisfactorily, and again SMC gave the better result, 0.03. Next. So this is the comparison which I explained you. Next. Now variable speed in flux weakening. Actually, flux weakening mode means we can run the motor above the base speed. So that is base speed means for which the motor is made. So I was able to run the motor above the base speed also, and satisfactorily. So this was very good result, and you can see red one speed was reaching up to 1000 and satisfactorily for with fuzzy logic speed controller also. Next. So this is ANFIS, ANN, and RNN speed controller. So you can see 340.014, 0.015, 0.014. But later on you will see that how much precisely it is controlled later in later slides. Next please. Perturbation in speed reversal. Actually, it's very important if we are working on a motion control. Speed reversal is also checked, whether during reversal there is a change in current found, but you can see very much sinusoidal currents available for all type of control. When motor is reaching from 0 to 340 or 500, then 500 to minus 500, then remain on 500, our current remains sinusoidal. Next. So flux weakening, as I explained, we are running motor at the higher speeds and beyond its rated value, and it is giving satisfactory results. So these are on the red, the time response of the motor you can see, and for different ANN based speed controllers and fuzzy logic speed controllers and SMC and PID and PI. So ANN based speed controllers giving us the better results. Next. Okay, so my topic was AI based motion control. So if you see the applications when you have to go under the sea and with some moving thing in your hand or other thing. So in that case, if you are going with wires, it will be very difficult. And if you are controlling something from far away place and it is all connected through wires, so it will be very difficult, and you can understand with wires control from very far away place is difficult. So sensorless control in that system is very popular and very tough also to apply. Next. So I did in that area also my research. Advantage of sensorless control: sensors are temperature sensitive, increase in robustness and reliability, cost and size reduction. Resolvers need special external circuits. Actually, resolver means sensors. So whenever we are using resolver, so that actually very complex and costly. So we will do without resolver. Here, if you can recall my first slide, one resolver was connected through PMSM. Now there is nothing connected to PMSM. PMSM free of the that resolver, and but we the power supplied to PMSM, you can see some half circles. So these are current and voltage sensors not connected to PMSM, but the current wires connected to PMSM. So PMSM is sensor free now. With this current and voltage which we are sensing from the wires which are going to PMSM, we did calculations inside the computer to calculate the current speed and current angle which were earlier taken through the resolver. So this is very tough job solving with the help of current and voltage informations. So we did this also. Some limitations are for sensorless controller. Next please. So various schemes of sensorless drives are available. So I did last two. So here you can see model based, last two, observer based and estimators. So sensorless vector control of AC drive, model based, back EMF director. I did observers and MRAC, and not model based I did not do. Last one, AI artificial intelligence based observer. Next please. Modeling of sensorless techniques for PMSM drive. Next please. So this is state observer. You can see the complexity in the next coming slides. These are the equation. Next, observer key. Next, these are some gains. 6 gains are required. These are 3 equations and so many things involved. So this is the MATLAB model of estimated observer estimation block of the observer. Next. This is no, previous just one second, previous slide. This was the MATLAB model of observer, and in every square there are lots of equations inside it. So this we did because we need data. So data will be obtained from this observer, that is very complex. But if we shift to AI, this complexity will be removed. So we had some input and output to this observer. Next. So this observer was placed here in the blue box. Previous. I will just take 5 more minutes. But previous, sir. Previous. This blue box is that space, that state observer, and sensorless. So the current information is going to into it, and it is giving us the command to control the speed. Next. So similar type of curves can be seen. Next, current voltage. So this is actually close view of the speed. Next. So close views here, oscillations can seen in SMC, but in other things, oscillations are reduced, and ANN, it is reaching very fast. Next. So this is the current diagram. Next. These are the angle for every controller. Next. And this is close view of reaching speed. Earlier I showed very far away view of this speed. Here you can see the difference. For fuzzy logic, you have offset, and for added there is steady state error, and for SMC you can find the oscillations. Next. So this is another view of speed reaching the targets. Next. This is torque for all controllers. This is current for all controllers. Next. This is speed reversal. Next. This is current when load is there, when reversal is there, for normal speed for all controllers. This is torque for all controllers with respect to current, etc. Now this is very important. I took very close view of the controllers when my speed was reaching 1000, but actually it was not reaching 1000 in many controllers. When I took a close view, it is reaching at 994, 993 for different control. Next. And their dip can be seen. In the earlier slide, dip was not seen. So fuzzy logic, ANN is giving better than fuzzy logic. Next. Fuzzy logic is reaching beyond 1000. So this is the conclusion, that PMSM drive with neural network controller is fastest amongst other controllers, hence may be used where precise control is needed, such as satellites, aircraft and operation, etc. Next. So again, NFIS controller. This paper is very actually cited paper. Here I reduce, I replaced resolver with the neural network controller. So that is very highly cited paper. RDC hardware replaced by AI algorithm. Next. So this was the algorithm which replaced AI, which replaced hardware. Next. This is the MATLAB model for that algorithm. Next. So this is how to do interfacing with my software and hardware. So this was done by using DSpace. So blue is the data coming from my hardware, and another black one is inside the computer. Next. And blue one is coming from hardware, and rest of the things are inside the taking place inside the computer, and output is also going from computer to be connected to the motor to control the speed. Next. So these are the resolver results, hardware results. Next. Another results, similar results, current and angle. Next. Next. So the PI and fuzzy logic controller based tip speed. So again, AI based control you can apply to anything. So wind energy conversion system. This is the thesis of my PhD scholar. He controlled wind energy system with using fuzzy logic, and he controlled tip ratio. You can go through the slides, and within seconds you can shift the slide how AI can be used. Again, next. Next. So this is wind energy system and introduction. Next. Okay, next. Here also fuzzy logic controller was used to control the PMSG. Here earlier I used PMSM to control SGB synchronous this generator, permanent magnet synchronous generator. Energy system has permanent magnet synchronous generator. So he controlled this generator using fuzzy logic controller. Next. So these are mathematics. Next. Similar fuzzy logic controller was introduced. These are rule based. He actually elaborated all those things. This is wind data. He was actually chasing this wind speed, and the motor was running according to the speed. Next, generator. Next. he actually shown the reaching load voltage, load current, and load power with the help of PI controller. Next, he also used similar type of fuzzy logic controller, etc. in the same thing, but for different application. Next, comparative study of PI and fuzzy logic controller. Next slide, please. So next slide. These are the references. Next. 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 Thank you. So here I would also like to inform you that looking at my papers which were published between 2005 to 2009. In 2014, Air Marshal SB Dev called me because he was working on missile and working on MATLAB also to control that missile, which was using PMSM. So Air Marshal called me at his residence because his lab was at his residence only, and I was actually amazed to see whatever I did in my lab, he was also doing the similar things. So he wanted my help in MATLAB simulations because that he was not academician, he was air marshal. So he although he had some engineers working on it, but he wanted my help in MATLAB. And later on, some accident happened, and he could not complete his uh, missile. He was making some missile and something prototype, so he could not do it because of some accident. So thank you so much. Thank you. Thank you for inviting me. Any questions?
Thank you, ma'am. If participants have any question, please raise your hand. I will make you unmute. Uh, Ma'am, I have one question though. I mean, meanwhile, others have raised their hand. See, I mean, we have the participants from various domains. I mean, not only from the engineering, we have from management
I know, I know.
and
That is why
applieds
I did
also.
not go
So
deep.
now I have one question. I mean, pertaining to the technicalities of things, so probably it may be not that straightforward to understand other. But in general idea, if you just take up the topic, so how we actually correlate in real life scenarios where people can actually understand the theme of AI in terms of this motion and all.
Motion means you have to actually,
I mean, that is
if
that
you
is pertaining to the topic that you are having. I mean,
if you look at fan is running, and it is in motion, and it has motor inside it. To control the air coming out of this fan, we need to control the speed. Everyone goes and control the speed by some switch. So if we want that this is automatically changed, then something has to sense the air, and accordingly temperature sensors will be used to sense the temperature and the air, and feedback system will be working to control the speed of the fan so that our air coming from the fan is controlled according to our demand of that type of temperature. So this is actually nowadays IoT is becoming uh, uh, in use. IoT means sensors and control. Sensor sense the current condition, and it sends this current condition to the controller, and controller give you the required output. If you are in America, you need all the time heated environment in the time of winters. So this is automatically controlled. Nowadays air conditioning is also controlled using AI means if we are sitting in a control room where 20-degree always is required, so sensors will sense that rise in temperature and send the information to the controller. And if controller is AI means it takes the information uh, uh, from the environment, and it gives the desired output. In between that black box there is something written through codes which is tuned also with the help of data which was input and output. That in the case of application, input and output are defined, like I'm taking the example of heat and cold. So input and output is the environment temperature, and output is 20 degree. So that controller is tuned for giving us 20 degree, whatever is the input to it. Input means any temperature you feed as input through sensors, it will give you 20 degree. So nowadays controllers are treated as black box if it is tuned through AI. AI means uh, 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 as we can decide that baby is born, baby after just his birth, he does not know who is my father, but he will see the father one or twice and thrice, and he will come to know that this is my father. Now this father can change the clothes, but he will recognize the father, that he is my father. Now this father can come with spectacles, he will recognize. So this is learning happened to that child, and he recognizes his father. So this same thing we do in our controllers. With the input for the child, input is the image of father which he can see, and his actually neurons have learned that this type of personality is my father. His how he speaks, how he look at him, what is in his body. Some parameters are actually given to the eyes of the child, and that child is tuned to know who is his father because of those parameters which he looks at his father. So similarly, same thing is goes for controller also. Some type of inputs are given. This controller will learn that if with this input, I have to give this output. So father can change the shirt from pink color to red color to blue color, but children will recognize that he is our father. So learning happens in AI control, AI based techniques because of some parameters.
Right, ma'am. Thank you, ma'am. Thank you very much. Any
Thank
other
you.
questions from the participants? Okay. So, ma'am, it is very insightful session. I mean, probably, I mean, those who are into it, they definitely are going to take out the things because the published research paper would be very boon in terms of looking into the things and work on it. And for others, they may be able to correlate with the things because in earlier sessions we have this IoT part, but now we are going to the intricate part of it that beyond that, how the AI is being related with the controller. Thank you, ma'am.
Thank you so much. Thank you for inviting me. I think my talk was too much technical, but I actually gave only 10% of technical things so that a different type of participant can understand this thing. Hope everyone could understand little bit of my presentation. Thank you so much. Thank you.
Thank you,
Should I
Professor
leave?
Gaur, for your yes.
Uh, Please continue.
Thank you, Professor Gaur, for your insightful presentation. Your session has provided deeper understanding of AI is driving advancement in motion control and automation. So, with this, we conclude day 3 of Faculty Development Program. We hope today's session have inspired new ideas and enriched your understanding of AI's real-world applications. Thank you to all the participants for your active engagement. We look forward to welcoming you tomorrow for day 4, where we will continue exploring such exciting topics. Have a wonderful evening, and we'll see you tomorrow. Thank you.
Thank you. Thank you so much. I'm leaving now. Thank you.
Thank you, ma'am. Thank you very much. So there is one message for the participants that we have uploaded the yesterday's attendance. So in case, again, I'm repeating, in case any issue in that yesterday's attendance, please ping it in the message board. I mean, we have not yet updated today's attendance, so please wait for it. Thank you very much.